Perfect.
Cameras. Okay. Thank you, everyone. Just a couple of points. So the meeting of the Special Committee on Canada-China Relations has booked this room at 5:30. So we will have a hard cap here at 5:30, so they can have their start their meeting with and be televised. And I suggest for the next meeting that people keep in mind topics of interest that we can consider where we're going to go in the future. With that, we'll carry on. I'd like to welcome the Department of National Defense, Major General Cadieux. Merci. Welcome.
Thank you.
Joint Staff. Major General Downs. Is that right, Major General?
Sir.
Okay. I don't read rank very well. I'm sorry. Surgeon General, Commander, Canadian Forces Health Services Groups. And we have back again, and thank you for coming back, we have Ms. Namisnowski. I'm going to get better with practice. President of the Public Health Agency of Canada, and the incomparable Dr. Tam. Thank you very much for coming back. So with that, we'll start with the Department of National Defense. I believe you have a 10-minute opening statement.
Mr. Chair, committee members, thank you for the invitation to discuss the role of the Canadian Armed Forces in the whole of government assisted return of Canadian citizens from China following the outbreak of the 2019 novel coronavirus. I am Major General Trevor Cadieux. As the Director of the Strategic Joint Staff, my role is to maintain the situational awareness of senior military leaders to draft directives for the Canadian Armed Forces and to work with other government partners. I'm looking forward to addressing any questions on the operational details of the Canadian Armed Forces role in the overall effort. I'm joined today, as you've heard by the Chair, by Major General Andrew Downs, our Surgeon General. As the advisor to the Minister of National Defence and the Chief of Defence Staff on all matters related to health, he will naturally be prepared to address any medical-related questions. I'll speak now about our role in the assisted departure. Le 31 janvier, les Forces armées canadiennes.
On January 31st, the Canadian Armed Forces received a request for assistance from Global Affairs Canada, the lead department for the first phase of the assisted return from Wuhan, China, to Canadian Forces Base Trenton.
Military contribution to this part of the operation consists of a medical team comprised of 6 Canadian Forces Health Services medical professionals. They're tasked to conduct health screening of returnees as part of the aircraft onboarding procedures in Wuhan and to monitor the health of returnees during the return flight to Canada. They will also conduct a final health screening on board the aircraft in order to inform Public Health Agency Canada officials as to which passengers, if any, require priority attention upon arrival in Canada. Our medical team deployed to this effort will be comprised of 2 emergency medicine and flight medicine trained physicians, as well as 4 aeromedevac evacuation qualified nursing officers. In response to a separate request for assistance received on the 1st of February from the Minister of Health, the Canadian Armed Forces will also support the reception, the staging, and the onward movement of returnees once they arrive in Trenton. Specifically, as part of the second phase, the arrival and the screening phase, Canada's military will support Canada Border Services Agency and Public Health Agency Canada by providing access to the runway and apron areas in Trenton, along with associated aircraft services and aircraft parking. Additionally, a variety of base infrastructure will be made available to our federal and provincial partners for customs and health screening. Also, as directed by lead departments, the onboard military medical team will assist with disembarkation efforts to include identifying priorities for disembarkation according to the medical needs. And finally, as part of the third phase, post-screening activities, we will continue to provide logistical and staging support. In essence, the Canadian Armed Forces will provide a logistical framework within which Public Health Agency Canada will coordinate public health measures, emergency social services, and security services with the province of Ontario for the period of the quarantine. Support provided by the Canadian Armed Forces during this phase includes ground transportation for returnees and supporting personnel, accommodations for returnees, infrastructure for use by federal and provincial authorities for the conduct of their tasks related to the quarantine period, food services, and general duties as required. Of note, Mr. Chair, Canadian Armed Forces members, to include military police, will not conduct direct security and enforcement activities relating to the quarantine of the returnees. This is being led by Public Health Agency Canada. However, the Canadian Armed Forces elements in Trenton will coordinate as necessary to enable civilian police and security agencies engaged by the Government of Canada to conduct those tasks. In closing, I would say that looking forward, the Canadian Armed Forces will continue to provide support as directed by the government while delivering on an array of other domestic and expeditionary operations. Au bout du compte, notre soutien.
Ultimately, our support to Canadians in need will always be our most important mission. We take this very seriously.
And Canada's Surgeon General and I look forward to taking your questions.
Thank you, General. We will now go to the Public Health Agency. I believe you have a statement as well.
I do.
10 minutes, please.
Thank you, Mr. Chair, for the opportunity to update the committee relative to the coronavirus, in the sense that we were here last week and a few things have transpired since then. I understand that on Monday, this committee also had an opportunity to receive updates from various departments involved in the government's response. Alors, j'aimerais tirer profit de cette occasion.
I would like to use this opportunity to recognize the efforts of all departments and agencies participating in the response in order to deal with the coronavirus and who are working closely with us.
So as you are aware, things continue to evolve globally in terms of the spread of the illness and the overall global response. So we continue to monitor the situation in China and other countries very closely to inform our own overall risk assessment. And I'm sure, as you're aware, that there are increasing numbers of cases in China. And at this point, there's approximately 24,000 that have been confirmed globally, with the vast majority in mainland China. And of those, the majority within Hubei province. And at this point, there are 27 other countries and regions that are reporting cases, including Canada. The increase in numbers we are seeing reported in China is not unexpected. Chinese authorities have taken considerable effort to contain the spread of the virus, and they've expanded production of medical products, and they've been sending additional health workers to support efforts in Hubei province. They've issued technical guidelines regarding the use of personal protective equipment, and they're increasing other venues for receiving and treating patients with mild symptoms or for medical observation of close contacts. As I said last week, Canada's public health system is well equipped to contain cases coming from abroad and their potential for spreading within Canada. There's a high level of vigilance and coordination by all levels of government, and we have protocols in place to monitor for illnesses and ensure the quick identification and isolation of suspected cases. The system is working as it should to protect Canadians against this novel coronavirus, and the overall risk to Canadians in Canada remains low. As part of Canada's overall response, on January 28th, the federal government and provinces and territories agreed to establish a special advisory committee on novel coronavirus. This is part of our federal, provincial, territorial governance, and it allows for a focused, time-limited mechanism for public health collaboration and information sharing between jurisdictions related to the response overall to the coronavirus. It continues to meet regularly, and as required, it provides advice in terms of the overall government's response and how that response should or should not be adjusted relative to what we're observing. The international response has also evolved in the past week, and on January 30th, the World Health Organization's Director General declared the outbreak of a novel coronavirus to be a public health emergency of international concern. Canada's response is aligned with the World Health Organization's recommendations. Last week, I also talked about the different measures that the federal government has put in place in terms of helping to prevent the introduction and spread of the disease within Canada, so I won't repeat what I said. I will just note that in terms of border measures, when I was here last week, I made reference to the fact that we have 3 airports where we've got focused efforts: Toronto, Montreal, and Vancouver. And in those airports, I made reference to the fact that we have, through the electronic kiosk, a question that specifically asked of travelers as to whether or not they've been in Hubei province. That question now exists in 7 other airports. And so in total, we have 10 Canadian airports that have a questionnaire as part of the electronic kiosk process, whereby travelers are asked to identify whether they've been in Hubei province. As of February the 4th, 2020, 855 travelers from the point of time when we started the kiosk, collecting that information by way of the kiosk, we've identified 855 travelers have identified as having returned from Hubei province, with 43 individuals referred for further assessment by a quarantine officer. Of those, 40 were released with an education handout, and 3 were issued an order for further medical examination. We also have our National Microbiology Lab, which performs confirmatory testing for any positive novel coronavirus laboratory result produced by a provincial or territorial public health laboratory. As of February the 4th, 2020, our lab has undertaken testing for 149 persons under investigation in Canada. And as you're aware, 4 have tested positive and 145 have tested negative. And to date, there are 4 confirmed cases of coronavirus in Canada and 1 presumptive confirmed, which was announced yesterday by British Columbia. Peut-être je peux parler un peu
Perhaps I could speak
repatriation of Canadians back to Canada. Et comme nos collègues ont mentionné, on travaille
As mentioned, we're working closely with our colleagues and counterparts in the federal government. There are many departments involved in planning
of the flight. So we are very much part of that process, as mentioned, and we're working very closely with all of our federal partners. And we are on the ground as we speak in terms of finalizing the plans that will enable the efficient processing of the return of individuals on the flight that has been announced by the Minister of Foreign Affairs. So as mentioned, there will be efforts on the flight as well as pre-flight departure to ensure that we have information on the health status of every individual that is getting on that plane, and that will enable us to be ready when people arrive in Canada so that we're able to respond in an appropriate way. So as I think the committee is aware, under the authority of an emergency order, we now have an emergency order in place that was made pursuant to the Quarantine Act, and that enables us to have the authority to keep all passengers at CFB Trenton for 14 days after the arrival of the flight. And this will allow us to undertake, full health assessment and the follow-up observation that will be required during that period of time. We also recognize that individuals that are returning to Canada clearly have undergone a fairly stressful situation. And so we are ensuring that we are offering, in addition to the type of medical assessment that will deal with their physical health, we're also very much focused on ensuring that we have the right kind of social supports in place to enable folks, or to enable all of those individuals to get mental health supports as necessary. And in that context, we are working closely with our colleagues at in the Government of Ontario, but as well as other partners such as the Canadian Red Cross. Peut-être je vais terminer mes commentaires.
To conclude, I would like to conclude my remarks, and we are ready to answer your questions. Thank you.
Thank you all. We'll now go to questions. We'll start with Mr. Bézan, 6 minutes.
Thank you, Mr. Chair, and I want to thank our witnesses for coming from Public Health Agency, and it's always great seeing General Dells and General Cadeau. Thanks for being with us today, and I want to thank the Canadian Armed Forces for what they're doing in assisting getting our Canadians home from China and facilitating their movement and providing the facilities for them to return home safely. A little bit of information I think some Canadians would want to know is how are we handling the passengers before they enter the aircraft, whether or not there's any pre-screening before coming on, and whether that's being done by Canada or by China. And then what personnel protective measures are being taken with flight crew, with the Canadian Armed Forces medical personnel while they're on board the aircraft. And of course, we know this is all recycled air. They're going to be on the direct flight for how many hours? 9 hours, 10 hours? So how is that being dealt with from a biohazard standpoint?
Mr. Chairman, maybe I can start with the process from the point of view of how it is we're taking people through the assessment or through the steps from the point of view of health assessment. So we are working very closely with Chinese authorities who have been quite clear that they will want to ensure that any individual that is getting onto the flight and leaving Hubei province is actually not symptomatic. So they themselves will be, having an assessment of every single person, which is not different for Canada relative to other countries that have actually repatriated their own citizens. There will also be a pre-boarding assessment that will be done by our colleagues in the Canadian Armed Forces. And then during the flight itself, we've worked with our partners to ensure that there is a comprehensive questionnaire that will be gone through with every single individual on the flight that will collect information that would enable us to have a good understanding of the individuals themselves, what kind of health considerations might be important for us to know, whether and who they may have been in contact with during the course of their stay in Hubei province, whether they themselves had been sick, whether they'd been in contact with somebody that had been sick, so that we have a really good understanding of each individual and the type of information that will be necessary for us as we continue the health assessments once they arrive. If there's somebody that is sick en route, we've worked on protocols that would ensure that those individuals, to the extent possible, are isolated from other passengers that are on the flight, that they are themselves given some equipment such as a mask in terms of ensuring that we're doing what's necessary from the point of view of other individuals that are on that flight. But if they are sick enough, we certainly would want to ensure that upon arrival that we have the right kind of, we do have the right kind of mechanisms in place where we would be transferring that individual to the local public health authority to make sure that they get the treatment that they would need in response to whatever they may be dealing with from a health perspective. And the same would hold true in terms of people that have gone then subsequently through the processing at Trenton. If we were to have an individual that became symptomatic, we would definitely, and we've already had and worked out the protocols with our local public health officials in Ontario, whereby we would have a seamless transition into the local public health system to make sure that individuals get the kind of support they need.
And from the standpoint of force protection?
Thank you. Our teams, our medical team that deployed last weekend, took with them a extensive array of personal protective equipment to include masks, gowns, gloves, face shields, etc. And the crew themselves will be wearing protective equipment throughout. Passengers will be offered protective equipment as well. But should one of the passengers manifest symptoms that would be consistent with coronavirus during the flight, they will be isolated so much as is possible in the aircraft, and they will be required to wear full protective equipment. And other passengers around them, if we're not able to properly isolate them or isolate them sufficiently, other passengers would be offered the same level of protection. So you could imagine this being very similar to the level of protection that would be seen in a hospital should a patient come in with these type of symptoms.
Okay. I appreciate that. I've only got 1 minute left. And I guess the question revolves around the physical facilities and how you're doing isolation on CFB Trenton. And what type of risk factors you're going to be mitigating, keeping proper distances from people in quarantine versus the day-to-day operations of the base. And so just wanted to get a little bit of idea about that and how, of course, that potentially people in the community are kind of, might be expressing some concerns.
Mr. Chair, just a comment in terms of the mitigation measures that we're taking at Trenton to mitigate the risk to the returnees, to the Canadian Armed Forces members, and then subsequently, of course, our missions as well. On arrival in support of CBSA, those individuals will receive an initial screening, after which we will transport them by bus to accommodations at CFB Trenton. The accommodations that returnees will be staying in, they are going to be in single rooms. Less families. We are making in support of Public Health Agency Canada arrangements for family units for their integrity to remain together. Each of those rooms they have bathroom facilities as well, so that they do not require shared use by the returnees. During the period of quarantine, those returnees will stay in what we're calling the Yukon Lodge. Those are the accommodations that have been set aside for only the returnees for the duration of their stay, and they'll have an opportunity to move about in that very local area, but they will not be mingling with other Canadian Armed Forces.
Thank you, Mr. Bazan. We go now to Dr. Pawlowski.
Thank you all very much for coming out today, and thank you for your work on behalf of all Canadians. I think you're doing a great job. We had Customs and Border Services come speak to us earlier in the week, and it seems if you come from Wunan or Hubei province, that initiates a process of screening and dealing with potential people who've been exposed to the virus, people who have symptoms. But am I wrong? But this is only being done with people coming from Hubei province and not from the rest of China?
Yes, Mr. Chair.
Now, my understanding, and John Hopkins has a dashboard showing number of cases from other provinces. There's 2 other provinces with almost 900 cases. There's a number of other provinces with over 500 cases. That's gone up pretty dramatically over the last couple of days, where it was almost half that number. And remembering there's up to 2-week quarantine period, these numbers are even going to go up higher. Have you considered possibly implementing the same provisions regarding all passengers coming from China, with the idea that perhaps really China's done a good job at barring the door, but the horse may have bolted?
So, Mr. Chair, what's very clear in the context of the Quarantine Act is that every single air carrier that flies into Canada has an obligation to ensure that if they have a sick passenger on board that flight, that they are making the Government of Canada aware of that prior to their arrival. And that ensures that, irrespective of where they're coming from, that we are equipped to respond as a plane arrives in Canada and deal with anybody that requires some level of medical treatment. So that applies across the board. In the 3 airports where we have the vast majority of flights that come from China, as I said, we have additional measures that have been put in place, and that includes at the kiosk a question related to whether or not you've been in Hubei province. But in the customs halls themselves, there are screens that are advising all passengers, irrespective of whether they've come from Hubei province or not, to make sure that if they're feeling sick, that they identify that to a border services officer. In addition, all passengers have the ability to have access to the information that's being made available to individuals that are coming off those flights, that provides them with advice in terms of what they should be looking for by way of symptoms, as well as what they should be doing in the event that they feel that they should be contacting local public health. And those handouts provide information across all jurisdictions as to who they should be contacting, and if they are feeling symptomatic and concerned and believe or have anxiety in terms of whether or not they actually may be symptomatic in relation to the coronavirus, what they should do to make sure that they're calling ahead and following the types of protocols that we believe are necessary to ensure that people are ready to receive them. And to date, that's exactly what has happened. And I think, as I mentioned, there are very few people that have actually been referred for any kind of medical assessment. And what we've seen to date, that the measures that we've put in place in the airport have done what we expected them to do. But I think, as Dr. Tam will probably speak to, the border measures are not a be-all and end-all, and we know that. They are but one level of effort relative to other things that are happening in relation to system readiness and response here in Canada.
Maybe just to add in what the President said is that obviously at the front line of all the health facilities, that's a very critical time point for assessment. And based on what all the provinces and territories are doing, they have a very low threshold at the moment for looking for anyone from, not just from the Hubei province, but from all over China. And they have the flexibility, and physicians do, of testing anyone that they suspect might have the coronavirus. And it's through that specific history, like have you been in a hospital or have you contacted someone with pneumonia, they have a very low threshold right now for testing. So far, though, all the cases that are positive have a link back to Wuhan.
Okay, my understanding is the United States is asking all people returning from China to voluntarily self-isolate for 2 weeks. United Kingdom, we were trying to figure that out. If they were, they weren't. That wasn't clear. I don't know if you have more information. Has Canada contemplated doing the same thing, asking all people returning from China to self-isolate for 2 weeks?
So the situation is continuing to evolve in terms of what's happening in China. I just want to certainly still underpin that the risk in Canada is low. We have very few cases. The chains of interruption has been contained. It's not spreading in Canada. So really is out of abundance of caution that, while risk is low, we're actually in quite a special period globally of containment. So if anything is going to be done to limit spread, it's sort of now. So I think Canada should be contributing to that containment effort. And so together with the chief medical officers and the special advisory committee, we're sort of adapting our advice. So as of essentially now, what we're recommending is that if you've traveled to Hubei province in the last 14 days, we recommend that you limit your contact with others. That is essentially what the United States and others think of as self-isolation, and that you should monitor your health and report to local public health if you have any concerns.
Thank you, Dr. Pawlowski. We go now to Monsieur Thériault. 5 minutes. 6.
You have 6 minutes. Thank you, Mr. Chair. Ladies, gentlemen, welcome and thank you for being here. You're enlightening us on a situation which is constantly changing, especially in China. It's changing rather spectacularly. We've surpassed the numbers of the SARS crisis in terms of statistics. Now, I read here and there that during repatriation, people who test positive, or not test positive, but have symptoms during the flight, would be redirected to the first stop in Vancouver. Does that mean we can't treat them on a military basis? We absolutely have to send them to a hospital if they have health problems? I just want to understand. There's a quarantine zone that's been identified, and I thought everyone was going to it and had on site everything that we needed to treat all the cases and to do that in isolation.
La question se pose au...
The question is for all of you. Thank you for the question. First of all, I would like to say that when it comes to the military side, we don't have facilities to treat a passenger that has coronavirus symptoms. It's really up to the province to provide that care. Does that mean at that time, let's suppose There are people who live in the Vancouver area. They go to a hospital there, they're treated there. People arrive in Trenton, and suddenly, oh, I don't know, there's people from Toronto, there's people from Quebec. We're going to remove them from the base as soon as they're sick, and we'll send them to an hospital because the base is just an incubation zone. It's not clear to me. Perhaps, Mr. Chair, I could try to answer the question. We are currently finalizing protocols with the province of Ontario. Currently, we have an approach where the province is so involved in the response, and I'm not sure of the acronym in French, but it's the EMAT, Emergency Medical Assistance Team. It's a resource of the
whereby they will be on the base, and should there be somebody that is sick, they will be able to take that person using their mobile capacity. They have actually a negative pressure room that they will have available for people, and they will be able to use that negative pressure room. They will be able to assess the individual in situ. They will be able to, if the person is presenting as symptomatic, they would be able to draw samples from that person, and we would be able, through our own mobile lab from the National Microbiology Lab, be able to test that sample there. If that sample was positive, then there would have to be a determination as to whether or not it was a mild case, because you know that some individuals within Canada that have had a positive test for the coronavirus have actually not spent time in hospital. So it would depend on the severity of the situation as to whether or not that individual would need to be transferred to the local hospital. But clearly, the objective would be to ensure that the right type of support is put in place to help manage that particular situation.
Chair, I just want to add, for the question of Vancouver, the idea is that no passengers get off in Vancouver. Only if there's an emergency, if someone had a heart attack or if there are other issues. What is happening is that the British Columbian teams are already rehearsing to safely transport, if there's an emergency, to their health facilities. So this is just a plan, if you like, but it is expected that we get everyone to Trenton as fast as possible.
OK. Là, c'est...
Okay, that's a lot more clear. Medical situations that are peripheral to the coronavirus infection, that's what I was trying to understand. The evacuation plan, where people stop in Vancouver, and if they need emergency medical care, has nothing to do with the coronavirus. Everyone who is going to leave China will land in Trenton. Now, when it comes to repatriation, numbers are going up. We're at 373 individuals who have requested repatriation. There's one plane that will leave tomorrow, if I understand correctly, for 211 people. Could you describe the selection criteria, not the visa or things like that? Are we granting priority to families or not? Is it possible that a family member or an individual might not be able to get on because we want to repatriate entire families? If a member of the family has symptoms, do they remain on site? Mr. Theriault, your question, please. I would like some details on repatriation and how you've selected those 211 people and when the second flight will occur and what we're doing with people who are waiting for the second flight.
Monsieur Président, je crois que c'est une question.
Mr. Chair, I believe that's a question for our colleagues at Foreign Affairs. I know that they have used the criteria to identify individuals, but I don't know exactly what type of criteria they used to choose the people who are going to be on that first flight.
Merci. Merci, Monsieur.
Thank you. Thank you, Mr. Theriault.
6 minutes.
Thank you all, the witnesses, for being here. Yesterday, health officials in British Columbia announced a new presumed case of novel coronavirus. The patient was a woman in her 50s from the Metro Vancouver area who had recently been in close contact with visitors from Wuhan. I think this would be the first instance of domestic transmission in Canada. Does this possible case of secondary infection change your assessment of risk posed by the coronavirus to Canadians, and how do you plan to respond? Either Ms. Namishnowski or Dr. Tan.
I'll respond to that question. So obviously, British Columbia and the health officials and the local public health unit are in charge of that particular investigation and has been in very close contact with the public health agency. So as I understand it, the potential transmission occurred inside a family setting. This is a household close contact transmission setting, which is not unexpected. And that does not mean that the virus was spread further. So they will be doing their investigation as to exactly what the situation is. And as with any infectious disease, public health units are very equipped to do case and contact tracing and management. But it would not be unexpected to have limited person-to-person transmission in a close contact setting, and it does not change our risk assessment for Canada, and the risk remains low.
Thank you. Now, the World Health Organization's February 1 situation report on the novel coronavirus stated as follows, quote, "The WHO is aware of possible transmission of 2019 coronavirus from infected people before they developed symptoms," end quote. And an early study on asymptomatic transmission of the virus was published last week in the New England Journal of Medicine. That also appeared to confirm that asymptomatic transmission is possible. So how does the existence of asymptomatic transmission change your approach to contain this virus, if at all?
So we are aware of a very small number of case reports where it's suspected that asymptomatic transmission may have occurred, but these have not been verified. In fact, in that New England Journal study, there's now been a publication to say that was incorrect and that this person was in fact symptomatic and had been taking some medication that suppresses fever, for example. So that's a very important fact to verify and correct. And so I'm very happy that German scientists and the WHO has verified that. We have heard other potential reports which have not been substantiated. So what we know is that could it happen? Possibly. We think it would be rare, and that asymptomatic persons it will be very unlikely to be the key driver of an actual outbreak or epidemic. What we are, of course, the evolving description of the patients has shown that they could have quite mild symptoms to more severe symptoms. And so some of the recommendations right now for people, for example, to really monitor the symptoms very carefully and potentially for reducing contact with others is so that at the earliest moment that they develop any kind of symptom, they should seek medical care. So I think that is very important. But it's really a droplet spread disease. So it's when someone's coughing most vigorously when they're more symptomatic that we believe that this virus is transmitted.
Dr. Tam, you anticipated where I was going to go next. So it seems obviously likely that there are individuals that are infected with the coronavirus who are going undetected because they are presenting mild symptoms and that's not interacting with health systems yet. If that's the case, can you give us an idea what proportion of overall cases that might represent?
It's actually a very evolving proportion because, as you can imagine, at the beginning of any outbreak is the most severe people that present. So many of the teams in China are currently unpacking the mild symptoms that are underneath the iceberg, if you like, off the tip of the iceberg of the severe cases. Right now, just proportionally, approximately 20% of cases are considered serious. So that does mean that 80% have some other symptomatology that is less serious. So that is a sort of fluctuating proportion based on current data.
To follow up with Mr. Pawlowski's question, the United States has implemented emergency measures to temporarily deny entry to foreign nationals who have visited China in 14 days prior to their arrival. Restrictions also apply to U.S. citizens who have been in China's Hubei province in the 2 weeks prior to their return to the U.S. Upon their return, those citizens will be subject to a mandatory quarantine of up to 14 days. They'll also undergo health screenings at selected ports of entry. In light of your comment earlier that if the time to contain is now, I think that was your word. It's very important that we get a good grip now. Shouldn't Canada be taking similar protective measures now, and under the precautionary principle to make sure we're doing everything we can to contain this virus at the earliest possible opportunity? And if not, why not? Why aren't we doing it?
As I think the president of the agency just stated, the World Health Organization declared as a public health emergency of international concern and indicate that right now we're in a containment phase. The most effective piece of containment, of course, is at source in China itself, where you're seeing some of the extraordinary measures that are being done. As you further move away from that epicenter, any other border measures is much less effective. I think data, public health-wise, has shown that much of this is actually not effective at all. We are doing some of those and adding those layers, but each of those layers is not a complete barrier, if you like. So we have provided travel health advice from a health perspective to indicate to travelers to avoid the province of Hubei and to limit non-essential travel to the rest of China. So that advice is provided to travelers, and of course, how you protect yourself when you're in China. So I think that's very critical. The other aspect is that you're not going to get health care, and particularly if you're stuck inside a quarantine zone, that's another reason for saying do not go to Hubei right now, not necessarily for health reasons. And the Global Affairs Canada has other reasons for safety and security as to why you shouldn't go to China. I think that the WHO advises against any kind of travel and trade restrictions are inappropriate and could actually cause more harm than good in terms of our global effort to contain. So I believe that Canada is taking a balanced and measured approach as it pertains to travel measures at this point.
That's over. Okay. Thank you, Mr. Davies. So we have another panel getting sorted out on video conference. So we're between kind of a rock and a hard place. So we don't really have time for a normal round two. May I propose to the committee that we repeat round one with 3-minute time slots for everybody? Is that acceptable? Yes? Okay. So in that case, we will go to Mr. Weber for 3 minutes.
Thank you, Mr. Chair. CFB Trenton, Major General, what is the quarantine capacity for that CFB Trenton?
Mr. Chair, the quarters, the accommodations that we're using currently for returnees, the Yukon Lodge, as I referred to before, that facility has a capacity of approximately 280 rooms. So those are single rooms with washrooms. What we're working out right now is, depending on the various demographics and family groupings of individuals that come back, that will reveal to us how many additional rooms that we have for returnees that are coming in. Mm-hmm. So it could well exceed 300, and we might be able to support the assist returnees, not just from the first flight, but others coming in as well. And so that number is evolving as we understand the various demographics and groupings of those returnees.
Great. So you have not thought of perhaps another facility, another CFB base that you may use in the future?
Absolutely. So in addition to working through the planning alongside Public Health Agency and Canada Border Service Agency. We are continuously forward planning, contingency planning. And so in addition to having a strong understanding of the resources that are available in Trenton, we are conducting a stock taking of all infrastructure and accommodations at Canadian Forces bases throughout Canada.
Great. You had also mentioned that your MPs will not be a part of the security at CFB Trenton for these quarantined individuals, that you'll have civilian police and security. Just why?
Mr. Chair, our military police are primarily mandated to look after the security of our bases, our Canadian Forces bases, our members and their dependents. Notwithstanding the support that we're going to be providing to CBSA and Public Health Agency, that work will continue and still needs to continue. And so in part for that reason, that's why the Public Health Agency is working with provincial security services to look after the needs of the returnees.
Thank you. The aircraft being used, pardon my ignorance, is it a Canadian Forces aircraft or is it a commercial type aircraft?
It's a commercial aircraft. So Mr. Chair, the first aircraft that's been contracted by Global Affairs Canada it's a civilian Airbus 340.
Chartered aircraft, okay. Just one aircraft is going to be used. It'll return then to China to pick up the rest of the individuals?
Mr. Chair, I think Global Affairs Canada is continuing to work through options right now. So there are a number of considerations that they're looking at. I don't think that determination's been made.
Okay. Dr. Tam.
Thank you, Mr. Weber.
Oh, that was quick.
Shorter. Mr. Fisher.
And thank you folks very much for being here today. The women and men of the Canadian Armed Forces deeply matter to the folks in Canada. Dartmouth Coal Harbour is home to CFB Shearwater, and with CFB Halifax nearby, I have a lot of military families at home who are paying rapt attention to what's going on in Trenton. I'd say that most Canadians have been watching the coronavirus situation closely, and they want to be sure that they and their loved ones are protected from this virus. We've heard a lot about misinformation and how it's spreading online, and how this situation is being sensationalized by some. Can you tell us more, one of the Major Generals perhaps, can you tell us more about how those being repatriated here in Canada from Wuhan, China, will be screened before and after they arrive back in Canada, and what measures are being put in place to protect military families and the general public in Trenton?
Thank you very much for that question. So there are multiple parts to the question, of course. The first element I'll touch on is the screening of the returnees in China. As has already been mentioned, there will be a first layer of screening conducted by Chinese authorities, followed by another screening by Canadian Forces medical personnel prior to the aircraft departing from China. During the flight, people will be monitored, their symptoms will be monitored and so on, and anybody who does become ill on the flight will be required to follow the protocol that I mentioned earlier of being isolated as best as possible within the aircraft and so on. And this information will be relayed to public health authorities here in Canada. Once the aircraft does arrive in Trenton, the jurisdiction of the Canadian Forces in terms of overseeing the health of the individuals gets transferred over to Public Health Agency to conduct the next phase of this operation.
And what measures are being put in place to protect the military families and the general public in Trenton?
We are, for the few military personnel that will be in direct contact with members of the returning group, they will be wearing personal protective equipment to prevent any risk of being exposed to the virus. And I would also I think it's important to highlight the fact that these returnees are healthy Canadians. And there is a risk, of course, that one or more of them might have might have been exposed to this virus. But I think that the risk is low that in fact is the case. So I think it's very helpful to keep that in mind. And then, of course, during the quarantine process, there will be the opportunity for monitoring of their health throughout, and all the containment measures that Public Health Agency has been planning will be applied. So I think that the risk to Canadian Forces members and their families is incredibly low. Thank you.
Thank you so much, Major General.
Thank you, Mr. Fisher. We go now to Monsieur Thériault. 3 minutes.
Merci, Monsieur le Président.
Thank you, Mr. Chair. Ms. Nemianowski, you said that on January 29th, that provincial laboratories were able to identify cases of infection, but the confirmation was being done in Winnipeg. Is that still the case? Would it not be more efficient for that to be done directly in different territories, provinces, and Quebec? Because every hospital, is it not able to make its own confirmation? If that's the case, that's good. If not, why not?
So there is a network of laboratories called the Canadian Public Health Laboratories Network that mainly are provincial laboratories. They're public health laboratories, and some of them can test for the coronavirus, but not all. The ones who can, you've heard, like Ontario and British Columbia, but because the testing is so new and this virus is so new, they are still sending the samples to the Winnipeg lab just to be sure that this is what we have. The idea, though, is eventually there will be tests that are more easy to conduct. They're not sort of trying to sequence viruses or detect the molecular genetics of the virus. That could, even commercial tests could be available at some point whereby many more people will be able to test for this virus. So I think it's just a matter of time, but right now, confirmation is felt to be the most prudent precautionary approach.
Vous disiez tout à l'heure, Dr. Tam, que
Dr. Tam, you mentioned earlier that there's increased controls that could cause more harm than good. What were you thinking of?
So we would, I think one of the members asked about travel bans, like stopping people from actually traveling. And the reason why the World Health Organization doesn't recommend something like this is that in general, it may do more harm than good. So if you stopped, I think someone mentioned that what the United States is doing, and stop traffic entirely, there's a number of issues. The international community must come together in solidarity to contain. If you have measures that very negatively affect a certain country that's trying very hard to do its best, it can impede whether this country in the future would ever share anything transparently with others. China had posted the virus, genome very fast. What are they getting out of it, right? So I think the idea is to support China. Obviously, some flights have already been reduced because nobody is actually going to China. But Canada has not closed its borders. It's using these layers of measures to screen people coming in order to still keep the movement across the border. The other thing is that medical aid, like teams, if you're going to support China in its efforts, or supplies, whether they're masks or gowns or something like that, those bridges must continue to flow. And so I think for all those reasons, the World Health Organization will not really, except for very exceptional circumstances, even ever recommend that. But as I say, the border measures that are most effective are at source, like in China.
Thank you. Merci, monsieur. Ms. Kwan, 3 minutes.
Thank you very much, Mr. Chair, and thank you to the witnesses. I guess the Minister of Health last week said in the House that those who are asymptomatic cannot spread the virus. I'm glad to hear the additional information from WHO seems to verify that, at least to that extent. But however, the Minister of Health in China has been reported to say that it can spread asymptomatically. So my question then is this: have we contacted China directly to ask this question for clarification? Because as was acknowledged last week by the panel, that China is has the foremost knowledge about the virus, and can we not contact China directly to verify that information? Because it seems to me that is a critical question that we should have a definitive answer on.
So the international construct is that the Chinese authorities have been providing data, and in quite a lot of detail, to...
Sorry, I'm just going to interrupt just because we run out of time. I had a conversation with the minister afterwards. She made that statement privately to ask her, do we have the capacity to contact China directly to ask that question? And she said yes. And I asked if she would undertake to get that information for us. And she said yes. I haven't heard back, but I'm wondering within the health officials if you have the capacity to do that. I understand that we deal with international framework, but we also have an opportunity, I think, to have direct contact with China to ask that question for clarification. Can we undertake to do that?
So I think, of course, there's different linkages, whether technical or scientific or through consular linkages, also through our actual operation centers. But I think what is difficult is that you actually need to, it's actually quite a difficult piece of epidemiology to ascertain in terms of whether some asymptomatic person could ever transmit. So it's not just a matter of just getting that data. The Chinese have been publishing the studies, and those studies are being critiqued on an international stage.
Yes, I understand that too. Yeah. But the Minister of Health must have had something on the basis in which that statement was made. And so I think going back to that source to say on what basis is that statement made, right, would I think provide an abundance of clarity for us. I think that the concern I have is this. I don't think people purposefully to go to spread the virus. It's the people who don't know that they might be a carrier and that in those instances that it might be spread. And so that is a major concern. We're hearing mixed information about the spread of the virus, right? In the case of BC, the individual who came to visit family here in Vancouver, in the Metro Vancouver area, presumably was asymptomatic when they travel. And if you're shaking your head,
not asymptomatic during travel, yes, but not after they come in.
So the person,
Time's up, sorry. Thank you all. Regrettably, we have some time constraints here. Thank you, Ms. Nemsnovsky and Dr. Tam. Thank you, General Cadieux and General Downs. We really appreciate your testimony. It's very, very helpful. And I thank you for your time. We will suspend briefly as, yes?
And I wonder if we can undertake to find out for this committee that question that I asked, whether it be from the Ministry of Health or from Foreign Affairs or whichever source, to get at the source of the quote that was provided from the Minister of Health about the virus being spread asymptomatically, to verify that information for this committee?
Absolutely. I will take that up with the Minister myself.
Thank you so much.
So we'll suspend for a few minutes and we'll bring the video conference online. Thank you all again. So thank you, everyone. So we have on video conference, we have from Toronto, Ms. Avi Go, Kenneth Lin, and also from Toronto, Dr. Davila. And we will shortly, I believe, have from Vancouver, Dr. Bonnie Henry, who is Public Health Officer. She's a little delayed. I think there's some delay at the airport or other. So I'm going to ask the witnesses to give us a short statement. Keep it as brief as you can. Normally we give you 10 minutes, but we are kind of constrained in time right now. So if you can shorten it up, it would be great. So we'll have the two groups here that are now here to do their statement. Hopefully Dr. Henry will come along in time to give her statement in that time frame as well. But we will adjust as we need to accommodate her. So with that. We'll start with the Chinese Canada National Council for Social Justice. Please go ahead.
So I would like to thank you for the opportunity to address the Standing Committee on Health regarding the response of the outbreak of the coronavirus in Canada. My name is Kenneth Lin, and I am representing the Chinese Canadian National Council for Social Justice. I am also the co-chair of the Chinese Canadian National Council Toronto chapter. With me is Avi Go, the clinic director of the Chinese and Southeast Asian Legal Clinic. Since the formation of the Chinese Canadian National Council, CCNC, exactly 40 years ago, the organization has spoken out against racial discrimination against Chinese in Canada. Among other things, CCNC took the leadership role in the campaign to redress the Chinese Head Tax and Exclusion Act, which led to a parliamentary apology for the head taxpayers and their families. Building on the legacy of CCNC, the Chinese Canadian National Council for Social Justice was launched in 2019 to educate, engage, and advocate for equity and justice for all in Canada. Specifically for the Toronto chapter that I speak from, we are currently an organization of Chinese Canadians in the city of Toronto that promotes equity, social justice, inclusive civic participation, and respect for diversity. CCNC-SJ's mission for equity and justice has been especially important to me in the past week as co-chair of CCNC-TO and personally as Chinese Canadian living in Toronto. Since the announcement of the hospitalization of 2 individuals with the coronavirus in Toronto, for Chinese Canadians, it did not only mean the arrival of an outbreak of fear, like all Canadians have, of catching the new virus, but this fear was immediately layered on with a pandemic of fear for being singled out, blamed for, and suspected of transmitting the virus, all simply for being Chinese. What makes the recent upswing of racism and xenophobia towards members of the Chinese Canadian community especially triggering is because it invokes our collective memory of the similar mistreatment and discrimination we faced during the SARS pandemic in 2003. The SARS pandemic in 2003 had serious health consequences for many in Canada, with 438 suspected cases and 44 deaths. But for Chinese and Southeast Asian communities in Canada, this was compounded by serious psychosocial and economic impact. Mainstream media constructed a media event out of SARS and fueled public fear and panic, contributing to the racialization of SARS. When anti-Chinese presumptions circulated, Chinese and Southeast Asians already working in precarious working conditions lost their jobs and were left with no livelihood. When customers stayed away from Chinese businesses and restaurants, this led to an estimated 40 to 80% financial loss to Toronto's Chinatowns. When many were assumed to be Chinese, they faced daily incidents of verbal harassment and physical violence. Today, 17 years later from the SARS pandemic, I witnessed the unfolding of a similar rerun of anti-Chinese racism with the novel coronavirus outbreak. This past week, my organization received angry phone calls, messages, and emails placing blame on the Chinese community for the coronavirus pandemic. This time, however, anti-Chinese racism is fueled by the powerful and dangerous tool of social media. In the past week, a CTV journalist was fired for posting an Instagram selfie with a Chinese hairdresser wearing a mask, stating in the caption, "Hopefully all I got today was a haircut, hashtag Corona outbreak and hashtag coronavirus Toronto." Still, In the past week, a video post was shared multiple times showing a customer walking into a Chinese restaurant named Wuhan Noodle with the caption reading, "The Wuhan virus has spread to Markham, a city just north of Toronto with a large Chinese Canadian population." As the World Health Organization has declared coronavirus outbreak a global health emergency, we can only expect more racist incidents. I will now turn to Avi Go to talk about her clinic's involvement during the SARS outbreak and our recommendations for the committee on how to address the rising xenophobia and racism.
Thank you. As Kenneth mentioned, I'm with the Chinese and Southeast Asian Legal Clinic, which is a community legal clinic provide free legal services to low-income members of the Chinese and Southeast Asian communities. So during the SARS outbreak, our clinic saw firsthand how racism and xenophobia affected the Chinese Canadian community. For instance, we were contacted by tenants who were evicted simply because they were Chinese. There were clients coming to our clinic who lost their job because the Chinese restaurants, they were laying off people due to business downturn. We also heard from Chinese workers who were terminated or were told to stay home because of perceived fear from their non-Asian colleagues. And as a result of that, many were, they had to leave their job without any compensation. Some were not able to access EI payments because of their status. Many are working in non-unionized setting. And there were also IRB, the Immigration Refugee Board staff, who insisted on wearing face masks during hearings concerning Chinese refugee claimants. Even an MPP from Brampton at that time suggested that SARS were caused by the federal immigration policy, as if the transmission of SARS should be blamed on immigrants. And since right now, during the coronavirus, we are already hearing similar stories. This is happening even in the legal profession, where a legal clinic in Toronto is imposing a quarantine on a Chinese-Canadian lawyer who just came back from China, even though he was nowhere near Wuhan and had no signs that he's contracted the virus. So, and at the same time, we know in Canada every year, we have about 12,000 people hospitalized and 3,500 deaths annually because of the influenza. No one has ever suggested that we should quarantine people just because they have a flu. So while Public Health Canada and the local public health organizations are working very hard to stop the spread of the coronavirus, we need all levels of governments to take the leadership to stem the virus of racism. And we need the government to provide support to not only those who suffer physically due to the virus, coronavirus, but also those who suffer economically as a result of racism. So we have a number of recommendations for this committee. Not all of them deal with health issue, but it's something that we would like this committee to bring to the government's attention. So first of all, we are calling on the government to set up an emergency fund to assist workers to help them recover a share of their lost wages if they do as a result of the coronavirus-induced job loss. And this fund can be modeled upon the Wage Earners Protection Program that we have currently, but reserved only for employees of bankrupt businesses. Second, we are suggesting the government should consider setting up a fund to assist small business who are hit by the virus and as a result of lost business. And third, this is a recommendation for Public Health Agency of Canada and the Provincial Ministries of Health. We're asking them to setting aside funding for public education campaigns to provide accurate and consistent information about the coronavirus in different languages, not just English and French. And this kind of multi-language public service announcement must also be disseminated through media, social media, as well as first language ethnic media. And finally, the campaign around information about the virus must be accompanied by an anti-racism campaign. And to that end, we're calling on the public health to work with the Office of the National Anti-Racism Secretary to combat racism and xenophobia arising from the coronavirus outbreak, and to provide immediate support through funding to Chinese Canadian community groups working on anti-racism, and also develop some long-term sustainable funding to combat anti-Chinese racism and hate in Canada. Thank you.
Thank you very much. We'll go now to Dr. Arlene de Villa, Medical Officer of Health from Toronto.
Thank you very much. As you've just heard, I'm Dr. Eileen Davila, Medical Officer of Health for the City of Toronto. Thank you to the members of the committee for giving me this opportunity to address you this afternoon. I will keep my remarks very, very brief. As you've heard, I'm the Medical Officer of Health for the City of Toronto. This allows me the privilege to lead Toronto Public Health, which is Canada's largest local public health agency, looking after the almost 3 million people here that reside in the City of Toronto. I'm just going to tell the committee a little bit about public health, as I'm not certain as to your familiarity with what the field of public health is. And because it's one of, I think, the best kept secrets we have. When you look at what public health is and you look for textbook definitions, what you'll often see is the description of public health as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. An interesting definition, technically very correct, but I find not particularly explanatory. So when I talk to audiences around what it is that public health is and what it is that public health does, I try to boil it down to its main objectives. And there are 3 major objectives of public health. First is to improve the health status of the population. Second is to reduce disparities in health status. And third, and perhaps most relevant in this case, is to prepare for and respond effectively to outbreaks and emergencies. Those are the 3 major objectives of public health. What's interesting is that in public health, if we're successful at achieving those 3 objectives, we by definition achieve a 4th objective, and that's enhancing the sustainability of our healthcare system. So that's a little bit of a primer on public health and what it is that we do. The other way I like to characterize public health is to describe it as that area of practice, which is, to my mind and in my case, it's a particular branch of medical practice that looks at the entire health of the population, so takes a population health approach and focuses on prevention, so as to help ensure that people start life healthy and stay that way for as long as possible. It is premised on a system. It actually has to be a system in order to be effective as public health. And it requires a great deal of expertise. It requires a broad range of skill sets, everything from a technical medical knowledge to epidemiology to an understanding of behavioral science and sociology and, yes, politics. So there's a broad range of skills that are required in order to be effective in terms of public health practice. And those skills need to be resident in the various levels of government. It is a cooperative and collaborative endeavor between the local, provincial, and federal levels of government, and it actually engages a broad range of participants, many of which are outside of the formal health system. I think what I will comment on at this stage of the game is that when we look at the novel coronavirus outbreak that we're currently facing, it's through these kinds of events that you can really see very tangibly from a public perspective the value of public health, particularly in achieving that 3rd objective, responding to, or preparing for, and responding effectively to outbreaks and emergencies. But I think you also see the relevance of that interplay and that system perspective, that there is a value and a role for the federal government and for federal public health agencies. There is a value and a role, and a significant role, for the provincial health agencies. And of course, there is a value and a role for those of us who work at the local level of government. With that, conscious of your time, I'm going to wrap up my remarks and happy to take any questions that members of the committee may have.
Thank you, Dr. Davila. Does Dr. Henry?
No, she's not. She'll appear there.
Okay. So we'll start around the questions. Dr. Henry may come online later, and unfortunately it's not ideal for the questioners, but when she comes online, we will interrupt and hear her statement and take the questioning from there. It's thank you, and so we'll start with Mr. Kitchen, 6 minutes.
Thank you, Mr. Chair. Dr. Ms. Go and Ms. Lin, thank you very much for your presentations. I'm going to apologize to you for a second. I just need to do something procedurally, and then I'll get back to ask you a question. Mr. Chair, I would like to put on notice of motion to be discussed in public forum the following two motions. The first motion is pursuant to Standing Order 108-1A, that the committee order all documents, including briefing notes, memos, emails, text messages, and summaries of phone calls prepared for the Minister of Health, Minister of Transport, Minister of Public Safety, Minister of Foreign Affairs, and Minister of National Defense regarding the outbreak of the coronavirus no later than February 28, 2020. The second notice I'd like to put forward is pursuant to Standing Order 108-1A, that the committee order copies of all correspondence between the Government of Canada and the provincial and territorial governments regarding the outbreak of the coronavirus no later than February 28, 2020.
Thank you.
Maybe just confirm if there's...
Oral notice, sorry, yes.
A notice will appear in that.
Thank you. Carry on with your questions.
Sorry, thank you very much. So, sorry, ladies. Appreciate your time and your presentation. It's greatly appreciated. And your comments are very, very pertinent to the issue we talked about. Doctor, I'm wondering if you can maybe enlighten us or expand to us on the issue of the testing process that's before you. I know you will obviously in the City of Toronto, as big as it is, have a huge concern about that. And obviously when we have people that are concerned to see about that, can you tell us that testing process, how does it work provincially and the testing process that you do? And then I guess my next question to that would be because you're doing that provincially, and I do believe that the testing process is valid and reliable, you then have to send that to Winnipeg. Can you just explain to us why that difference is? Are you comfortable that you could actually do that without having to follow through to Winnipeg?
So thank you for the question. And I will do my very best to respond to it, not being a laboratory medicine specialist myself. But the short version of the story is that you have a new virus. This is a virus that was only identified about a month ago. So in the world of lab medicine and microbiology in particular, they're very precise. They're scientists. So we have a test here in Ontario that's conducted by the provincial lab, the Public Health Ontario Laboratory. And the fact that the virus was identified only a month ago and that we have a test is a remarkable accomplishment in and of itself. That's not unique to us. There are other labs around the world that have this. But effectively what happens is that the tests are conducted on the patients here. It goes to the provincial lab. They give us what's called a presumptive confirmed test because it's a first test. So if the test is positive or it indicates the presence of the virus, it's positive. And because we're talking about a new virus, a newly identified virus, a second test needs to be conducted. It is a different test, but it also tests for the presence of the virus, and that test is done at the National Microbiology Laboratory in Winnipeg. So because you have a new virus and a new entity, you need two tests in order to precisely identify it and confirm that it is a positive test for this new coronavirus.
Thank you. The Americans have basically come out saying that they will only recognize testing from CDC attested. Are you aware of that?
I'm not particularly familiar with what's happening in the U.S. laboratory system. I apologize for that.
That's okay. I appreciate that. It's just and so it then makes me wonder, and I don't know whether you're aware that the World Health Organization has asked, or basically have come out and asking for $675 million to assist them. And I'm just wondering, do you see that? I mean, that's a huge amount of money, obviously, and we want to make certain that we're protecting countries that can't protect themselves, and so we need that assistance. But I guess the question is, where would you see that money being utilized, possibly in testing procedures, or would you have any thoughts on that?
Well, again, not being familiar with what circumstances the WHO is seeking to address, it's difficult to comment on that. However, like with many infectious diseases, often the best strategy is to strengthen the capacity for those other nations and other jurisdictions where, frankly, the capacity doesn't exist, right? Infectious diseases don't respect geographic boundaries. So, the stronger we can make all the links in the chain, the better we are in terms of protecting not only ourselves, but everybody else around us.
Thank you. Earlier today, we heard from the military on with the evacuation of Canadians from China to Canada, and where they will be then brought into Trenton and then isolated and quarantined in that area. Has that been part of your discussion within the City of Toronto? Is that something that's actually being talked about? And I'm wondering if you could elaborate on any of that for us.
Well, certainly we've had some discussion around that. It's a matter of interest. It has it being part of the public health response to the novel coronavirus situation. Again, not being a jurisdiction that is directly impacted by that, I can't tell you that we've had, in-depth conversations on that. But certainly we anticipate that some of the people that will be arriving in Trenton may be residents of Toronto. We're a large city with a large number of residents, and we would expect that some of them might eventually come our way. So we've certainly had some conversation.
Thank you, Mr. Kitchen. Monsieur Thériault, allez-y. 6 minutes.
Monsieur Thériault, you have 6 minutes. Ladies, welcome. I will speak slowly. Désolé, sorry, it's the Liberals' turn for 6 minutes.
All the panelists for answering your questions. I represent Brampton South, and our city recently declared healthcare emergency. Our only hospital is functioning at more than capacity, and while the risk of coronavirus is low, but is there any plan in a place where if the outbreak happened, where already health emergencies declare 650,000 population and only one hospital? So what kind of the plan in a place? My questions to Dr. Aline. You already served Peel area, and we are already shortage of healthcare services.
So thank you for the question. And yes, having been a medical officer of health for Peel Region, I'm quite familiar with the circumstances in Brampton and the challenges with respect to healthcare access. With respect to how the situation is being managed, I would actually defer to my provincial colleagues, but suffice it to say that I actually am having conversation. Just to give you a little bit of a flavor, as I talked about, in public health, responding to outbreaks and emergencies is part of our role. And I can tell you that in Toronto in particular, we have moved into what we call the incident management structure, which is a very standardized approach to responding to emergency type situations to ensure that you are bringing enough resources to bear. And one of the functions as you seek to respond to an emergency using this structure is what we call a planning function, looking forward, trying to, imagine where the situation will be in a few days rather than just focusing on the emergency in front of you right now. So one of the issues that we have been actively discussing for the city of Toronto is, what if, right now you said the risk is low, and you're quite right. What if the circumstances change? How would we manage that? And what sorts of healthcare facilities might we need in order to address that? So we're having those conversations here in Toronto. I have raised them with our provincial partners and our hospital partners as well outside of Toronto, at least through the member association. But I don't have all the answers for you, but I do know that there are active conversations happening on that, and there are multiple solutions that could be put into play. So, and they're actively being discussed.
Thank you. I want to share, Mr. Chair, I want to share my time with Tony Bannerman. So please.
Thank you. How much time do I have, sir?
3 minutes.
3 minutes? Okay, thank you. So I'm equally concerned about things that we can't treat with medicine, and that is the discussion that we've had around the discrimination. So in addition to the making up the up-to-date evidence-based information available on the canada.ca/coronavirus and the travel.gc.ca, as well as a toll-free number, what can I and my colleagues do to address the misinformation that is circulating online to ensure that our Asian Canadians feel safe in their own communities?
Maybe I'll go first, and I'm sure Kenneth may have other comments as well. And I think, and certainly I really appreciate the question and the fact that you have identified that is a concern that we should all address. And in a way, having gone through the SARS experience, we are in a way much more willing this time around to start talking about this issue as the outbreak just began to emerge. So I think it's really upon, the duty is upon all of us to find ways to disseminate, correct and accurate information to counter some of the misinformation that is out there. So I think that perhaps what we have done so far is, in Toronto, we're working very closely with the Toronto Public Health, and I would certainly encourage that all the MPs within their own ridings, within their own cities, to work with your local public health agencies to develop plan and disseminate information through the local network. And at the same time, how do we think about utilizing different forms of media, because a lot of stuff is going on through the social media. So whatever information that we develop must also be disseminated through the social media as well. And even within our own community, within the Chinese Canadian community, there is this misinformation also, which is why I emphasize it's very important that all of the information that the scientific-based, evidence-based information must be made available in different languages so that people will be able to access it. And to be very frank, many of my clients will not be going to the government website. They will be getting their information through other kind of websites. There's, for instance, the 51.ca is a very common website that many Chinese immigrants access. So we have to make sure that our information is being delivered to other websites or link provided to other websites, working with the Chinese language media and other language media to make sure that people in different communities are able to understand and access those information as well.
Thank you. Very quickly, please.
And in addition to what Avi has said just now, I think what we see currently is that social media has become such a powerful and dangerous tool that is, like, because of what the new coronavirus is coming out, has become a platform to which racism has allowed to be more overt, where a lot of the ideas these people have had in mind in more covert racist kind of ideas, using this unknown time with a lot of fueling into the moral panic, which now we see that social media becomes that platform. And so ongoing anti-racism funding to support the work and organizations that have already been doing work on anti-racism needs to also happen.
Great. Thank you. Maintenant, Monsieur Thériault.
And now, Mr. Thériault. Thank you, Mr. Chair. This is our second take. Ladies, welcome. First of all, Mr. Chair, I would like to make a comment. When it comes to public health, as a representative, an elected representative, I think that in the face of a crisis of this nature, a public health crisis, we need to base our reaction on a notion of responsibility or accountability. No one here wants to increase suspicion or susceptibility. We all need to be careful and ask questions because we represent the people who is also asking questions. Our questions must always rely on this notion of prospective responsibility. What will happen tomorrow? We have a responsibility with regards to what happens tomorrow. And when it's an issue of contamination and spread, we're not talking about a pandemic. Perhaps we never will. We need to be careful about what we say. And ladies, it's fortunate that viruses are not gendered or racialized or discriminatory. If they have one characteristic, it's that they can mutate. And so that was what I wanted to say. We should not play political games here. We need to do politics with a certain degree of nobility. Now, Public Health Canada has told us that they're working very closely with different provinces, territories, and Quebec, namely with various public health agencies. Now, as you are representatives of the public health system in Ontario, when it comes to contingency plans, do you have a plan in place? Could we see the nature of these response plans? Because we've been updated, but nothing has actually been tabled. Would you be open to tabling your response plan, given that you are part of one of the most public health agencies on the Canadian territory?
Excuse-moi, c'est une question pour Dr.
I'm sorry, that's a question for who? For Dr. Davila.
Yes, so thank you for the question. We do have, as most public health units, we have obligations. So let me speak to the Ontario context. I'm going to start there. In the Ontario context, we have something called the Ontario Public Health Standards. And all local public health departments are expected to adhere to those standards. And one of those standards includes having emergency preparedness and response plans for all kinds of emergencies and all kinds of health hazards. So as a local public health unit, we do indeed have an emergency response plan to deal with these kinds of situations. I think the other important point to note is that it is within the regular work of public health to respond to infectious disease so as to mitigate the risk or the negative impact associated with infectious diseases. So this is part and parcel of our work. It is what we do on a daily basis. Novel coronavirus is a new infectious disease for us.
Excusez-moi, je viens de vous couper, mais...
Sorry for interrupting. Are you telling me that you don't have a specific plan when it comes to the coronavirus? Because you have plans that you have in place regularly to manage emergency situations. My question is very specific. Could you send your plan to us? Because up until now, we have nothing available to us in order to assess public health response plans, whether it be Health Canada or what's happening in different administrations.
So to answer the question specifically, I'm happy to share with you what we have in respect of responding to infectious diseases. I will tell you that this novel coronavirus was identified a month ago, but I will remind you that infectious disease response and management actually is there is an approach and a framework that we use for virtually all infectious diseases. It does change depending on the nature of the infectious disease and how it's spread. However, there are basic principles and a framework for responding to infectious disease outbreaks and how to manage those particular risks. And I'm very happy to share that.
You have 22 seconds left. Thank you. So I see that Dr. Henry has joined us. However, I believe that we should go to Ms. Guan for her 6 minutes. And then, unfortunately, there won't be very much time for Dr. Henry to speak to us. But we'll do our best. We're going to be kicked out of this room in like 10 minutes. So thank you for coming, and hopefully we'll get to hear from you. So, Ms. Guan, 6 minutes.
Thank you very much. I'm actually going to ask some questions of Dr. Henry, if I may. And so we understand that there is a second case, a presumptive case in the Metro Vancouver area now that's been identified. I'm wondering, was the person who spread the disease to the family members in Metro Vancouver, was that person asymptomatic at the time of travel? Is that something that you would be aware of, Dr. Henry?
Yes, and we are very cautious with details of personal health information, but there was no concern about anybody being symptomatic during travel.
Thank you. And do we have the information on when she traveled, when she first boarded the plane to come to Metro Vancouver?
This person has not left Vancouver, the case. There was
Sorry, I meant when did they arrive in Vancouver?
There were visitors who arrived in Vancouver several weeks ago.
So several weeks ago. So from my understanding in reading the news report, the travel took place prior to China closing the city of Wuhan. So several weeks ago she arrived, and she was asymptomatic at the time of arrival. And so then this would be a demonstrated
Family
case.
members who have come to visit from Wuhan, more than one. They were all left Wuhan before the travel restrictions were put in place, and none of them were symptomatic during travel.
Okay. And so now that means they were asymptomatic and they came here, and the secondary transmission occurred here to the families in Metro Vancouver. So then that means we actually have a case of a situation where someone is asymptomatic and the virus was passed on.
That is not correct. I said they were asymptomatic when they traveled, and there was transmission within a household with very close contact. They became one person. There was a number of people who traveled. One person who traveled developed symptoms, and then there was transmission within that household.
I see.
And the person we've identified has not traveled. They were they got the infection from close contact with a person who developed symptoms while they were here, who had traveled from Wuhan.
I see. So is there any concern at all then for the other passengers on the plane who might have been in contact or close contact with this individual or individuals?
Not at all.
No. Okay. In terms of preparedness for the virus here in British Columbia, you know, my office today, for example, someone approached my constituency office asking us to buy the masks. And so, so there's that sense of concern in the broader community. And I'm just wondering if you can share with us in terms of preparedness, what information can you share with us that we can pass on to our constituents about our state of readiness so that people can hopefully allay their concerns?
So we have been, that's one of the reasons I'm late coming here, is because we've been doing press media and briefings about what people can do and what they don't need to do within our community. So I spent the weekend talking with a lot of the ethnic media in Vancouver about the issues, the risks here in Vancouver. So we have a lot of materials, and they're available through the BC CDC website. That is our source of truth, if you will, here in British Columbia. And there's a lot of information there. And we also have information that we've been giving out through a variety of different sources. So if there's specific things that you're looking for, we're happy to provide them.
Thank you. You have updated Dr. Henry from the previous media appearance to say that individuals who may have been in contact with or who may have traveled from Wuhan to British Columbia should self-isolate for 14 days. That's what I've read in the media. Is that correct?
Slightly nuanced. What we've said is we know that during this very critical time, there are people who have been in Hubei province, so not just Wuhan, but the other cities where there's a lot of ongoing transmission. And we know from watching what is happening in the evolution of the outbreak in China that it's becoming very apparent that that is really where the concentration of transmission continues. And we're in that period of time where there are still people coming from that area, small numbers, and where people who have come prior to the travel restrictions being put in place are at the very end, some of them, but are still within that incubation period. So we want everybody to be exceptionally careful right now. And so we have recommended that people who have come from Hubei province, that they self-isolate at home, and we will support them in doing that. So that's not going to school and not going to work until they've been 14 days away from that contact in Hubei province.
Is that just limited to Hubei, or is that extending to other areas of China as well? I ask this question because British Columbia have a lot of individuals whose home province historically is Guangdong province, and that virus has spread to Guangdong as well. So I ask this question in that context.
Right now, what we're talking about and the messages we've put out is focusing on Hubei, because we know that actually as the numbers increase, the percentage of cases that are related to Hubei are still going up. So that tells us that the transmission there is what is really driving this right now. So we have focused on Hubei, and we've focused on everybody who has had travel to China or has had contact with somebody from Hubei needs to be exceptionally careful, particularly right now, because we know we're in that incubation period time where people can develop symptoms. So we're putting out the message for everybody who's traveled to be really, really careful and to monitor themselves and their children for any symptoms and self-isolate and contact us immediately. But the focus about staying home, even if you are well, is focused around Hubei province.
Thank you, Ms. Kwan. So regrettably, we've come to the point where we have to bring this meeting to a close. I apologize. Is there anything you can leave us with, a quick 1-minute statement that we can take away?
Sure. And just to say that, we have been working very closely with our colleagues across the country and Dr. Davila and others and the Public Health Agency of Canada to try and have a coordinated approach to this. This is something that we are watching very carefully, and we have stood up what we call our emergency response structure with our EOC provincially here in British Columbia to make sure we have those common messages that go out to everybody. And I think the detection that we found of these 2 cases so far, I expect there may be others, really shows us that our public health system is working, that we have what we need in place. We have the laboratory testing that we need, at least in British Columbia. And, it's going to be a little bit of watching what's going on in the rest of the world and hoping in many ways that what is happening in China will prevent this becoming a widespread pandemic. And the messages that I've been putting out to everybody is the things that we do at this time of the year all the time are the things that are going to protect us from this virus right now. And that's washing your hands regularly, keeping your hands away from your face, covering your cough, and staying home and away from others when you're ill yourself.
Thank you, Dr. Henry, and thank you to all of our witnesses. And with that, we'll adjourn the meeting.